There's no doubt that this network will be important for professionals, especially physicians, hematologists. How will it be important for the clinical outcome and quality of life of patients?
Well, in fact, what the most important objective of this network is to decrease the inequalities. That means between the different European countries, because as you know, there are a lot of differences in healthcare services between the countries. Some are very low and others are higher. So this is a very important point. So to give the possibility, the availability that each patient and also physicians for information can get these services independently from the place in which they are living. So this is very important also for the patients.
Okay, and I think because there's going to be direct involvement of the patient support groups in this network, so it will be they will be involved from the beginning to the end, and will be able to have a say and orient some of our decisions of our organization. For oncological diseases, malignant hematology, there are some cooperative groups, but they are mainly research-based and physicians-based. And the idea here is to have groups that will be patient-based and healthcare-based. So it will make a difference. And for that reason, patient support groups will be directly implicated, including in the governance. And so that things are a bit different from classical cooperative groups that already exist at the European level and sometimes are organized by EHA or work in close cooperation with EHA, like the European Leukemia, like EC-sponsored projects like MDS Right and others. But this is original, and patients will be more directly involved, and including, I think one of the big aims is that indeed we should allow all EU citizens to have access to the best possible healthcare. So it means that in some cases, even if in a given country a patient cannot have access, then we'll have to think that in the surrounding countries, healthcare access for specific diseases can be obtained, and that's one of the goals. And so we will know with this network where these specialists are, and I think it's going to be.
Yes, I agree with you absolutely, because in fact the big differences between before and now is the empowerment of patients and the contributions of patients to our work, the work of the network. Patients are very important, as I mentioned also today, because the patients are the best, who know the best their disease, better than some physicians, even specialists, and they can give, in fact, the patients they know very much why they have. So the contribution, that means the knowledge, the contribution of any help that patients can give to the development of the network, that is essential. And for me, this is the big differences between how we will work now in the future and how we have worked in the past. So that is for the European Reference Network, that is the most important point. So the patients will get their own empowerment. They have, I remember before was a problem that you probably know too. Patients were neglected, in fact, were neglected. Now patients are our collaborators, and that is the difference.